Hi class, this is Eloise Ramirez. I will be discussing neurocognitive disorders. Part B, I have neurocognitive delirium. Um, so neurocognitive disorders, there's a couple of forms of neurocognitive disorders. There's delirium, and then there's major and mild neurocognitive disorder. As stated earlier, the section that I have is um, or the area that we're working on is delirium. Um, Delirium basically is a condition in the mind where the person's mental abilities are reduced significantly. The disorder causes extreme confused thinking in one's environment. It can occur pretty quickly, or it can develop, um, throughout the course of the day. It can happen over a short period of time, or within a couple of days, you can start experiencing symptoms of delirium. As I already mentioned, it's basically a condition in the mind where there's just extreme confusion to your environment, to your surroundings. It can be caused by a variety of different reasons. It can be caused by um, physical or mental illnesses. It can be a cause of um, drug use, medication-induced delirium, several different medical conditions. Um, According to the research the article that I read about delirium in the elderly patients, it happens a lot, post-surgery, during their hospital stay. If there's deficiencies in nutritional deficiencies, um, different physical conditions can cause delirium to occur. Um, Again, here is just briefly reviewing the article about elderly patients who have delirium. Some of them already come into nursing homes or to the hospital with a diagnosis of being delirium, and the majority of them um, are then later diagnosed with delirium after their hospital stay. Um, right here, it even states in the research that delirium is common in elderly patients, but more common in patients who are in um, have more serious medical conditions or in the ICU unit. Delirium can be detected several different ways. It's either um, there's a variety of different ways to assess delirium. The most common instrument that's used is the MMSE, which is mini mental state examination. It's the most common most common tool that is used to diagnose delirium, or at least to assess if a person has delirium. There's also more specialized tools that could be used, um, thorough examinations that are used to detect if someone does have delirium. Um, in the research in the article that I read in delirium in the elderly, it can be prevented or at least reduced by being able to detect delirium in the earlier stages. Um, Ways to prevent delirium is really orientating the patient to their surroundings, making sure that any physical conditions are being treated, um, that they're given the correct amount of medication, and that they're on the correct medication. If they need hearing aids or um, eyeglasses, things like that, those things need to be working well for the patient in order to um, have them oriented to their environment. This is one way to at least prevent it, or at least minimize the effects of the patient having delirium. As I stated earlier, some ways to detect delirium would be with really looking at the patient's history, seeing, doing examinations like the mental mini state exam, doing a physical examination, just thorough history of their medical conditions, the vital assessments, lab works, those types of things will definitely help a provider or physician determine if a patient is, having signs of delirium. Um, these are several different national web resources that I came across that provide a lot of different information, not only for the patient who has delirium, but for the family. Um, a lot of it dealt with geriatrics and just providing support and further education on the topic of delirium. Just that's it. Just a brief overview of what neurocognitive delirium is, and my article was on delirium with elderly patients, and there are the 5 different resources that we can refer back to for further information about delirium. Thank you so much.